The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we're going to be talking about Medicare. Particularly, we'll be talking about Medicare and You. You received this book early October, and it has some improvements over last year from Medicare, but it also helps to define exactly what benefits you can have. Now, there might be some things that you might be a little confused with, but don't worry, we've got some people to help you. Stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Montanans are independent. We're also responsible, protective, and committed to our families and communities. That's why we've done so well against COVID-19. As we open up, we've got to keep doing what we do best. And it starts with each and every one of us, protecting public health in the 406 for our families, friends, and neighbors. We all have to do our part. Montanans get that. And we've got this.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. And as I mentioned, you received in early October Medicare and You booklet. It outlines what Medicare is. There have been some slight changes over last year, some improvements, and we're going to discuss that today. The open enrollment period runs from October 15th through December 7th, and it's important to reevaluate what Medicare is doing for you, what it has done, and what it can help address some issues in the future. Of course, joining us is Kimmy Everman, your special projects with DPHHS. It's great to have you back here.
Thank you.
We're in the middle of open enrollment right now, and when we talk about open enrollment, it happens every year, but why is it important? What changes? I mean, why do we have to reconsider our Medicare plans?
Okay, well, first of all, let me start with the open enrollment or annual enrollment every year runs from October 15th through December 7th, which of course is Pearl Harbor Day. So that for me is a very nice sort of reminder of how long it all lasts and that sort of thing, and that it comes every year. Okay, then I guess the biggest thing, Brian, is that we have many plans for folks that are on Medicare, different plans to choose from, and they change on a regular basis. So every year, it's just really imperative that you take a look, even if your plan is great. You love it. I remember my mom saying several years running, she really liked the plan she had. Well, we looked anyway, but she had no intention of switching because she liked it so much. But we didn't find anything better either, or more applicable to her life. So, it's very important that we check that out each year. Now, and there's some parameters. First of all, coverage. Does the plan that you have cover everything that, all the medications that you take? Over the year, over 2020, have you started taking any, new medications that needed to be added to your list? If so, let's check all the plans to make sure, because you know what you're paying for it under your current plan.
Yes.
But you didn't pick your current plan with that in mind. It came during the middle of the year.
Yeah.
So this is a way of checking to make sure that you're getting the best price on the medications. I think the next, really biggie for me, especially during pandemic times, is mail order. The formulary and the mail order are two really important pieces of open enrollment. Formulary means the list of medications that every plan is going to cover. And I've told folks before, there's at least 212 drug classes that are represented on every formulary. So every single formulary has to have a med from all of those classes. And some, they cover all, like cancer drugs. But so there's the formulary, and does the formulary have the medications that you take and you feel are best for you? Again, it might be a generic issue, might be, there's many issues that go into picking that. So that's a biggie. And I think just customer service is always huge. As well. Did you have a year of struggling to get a medication paid for, or whatever? Did you have a struggle? Were they kind to you and professional to you? And if so, okay, that's pretty good. But if not, then let's take a look and see what else there might be.
Right, yeah. And you say, let's take a look at something else there might be. When we talk about all the drugs that are available, 220 classes, perhaps your doctor prescribes a certain drug in that class, but they don't cover it. But many times you don't know until you get the bill.
Exactly.
So how do you find out? It seems like it's pretty complicated coming into this for a lay person, much less a senior.
Well, and you know what? Our audience is going to know when we say ship counselors. Call your ship counselors. And and I want to say, I should have said this at the very top, but we are in the middle of open enrollment season. Those ship counselors are very, very busy folks. Get in early. Call right away. We'll put the number up on the screen. You can call your area agency, find your local ship counselor, and get an appointment. And maybe you don't need an appointment in person. Maybe you just need some guidance to get through some of the big issues that you're looking at. They can do it over the phone.
You just give them a call, and what's important, I like to note, is that they don't have anything to sell you.
Exactly.
They're very independent. Now, they're based out of area agencies on aging, which are throughout the state of Montana. And the individuals are probably in your hometown. They have so many of them.
They may be your neighbor.
And it's confidential. And,
it is.
Can you kind of go over quickly what the plan finder is? Because the plan finder is a good component to complement talking to your ship counselor.
Well, the plan finder, you have a mymedicare.gov an account. It's very secure and safe. It is a computer database that you put the medications in that you take, you type them in, and then you press submit, and what comes back to you is a list of the plans that are available, starting with what looks best for you based on the things that you put in that were your kind of wish list. And you're right, it sounds complicated, but ship counselors can help with it, and also it isn't quite as complicated as it might feel. Once you do it, it's pretty easy peasy. So you can get some assistance that way, some guidance.
Okay, and what's important to note is they don't make the decisions for you. You make the decisions. They give you the information, but when it comes time to decide, it's your decision. Now, we'll be talking about some improvements to Medicare in our next segment, so stay tuned.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
3,000-pound walrus? Good insulation. 10-pound Sphinx cat? Bad insulation. Puffed up cardinal? Good insulation. Naked mole rat? Oh, bad insulation. If your home's insulation isn't all that it could be, the Low Income Energy Assistance Program may be able to help. Call today. You just might be eligible for weatherization assistance, and that could make your nest a little cozier.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion particularly about Medicare and You. This booklet that you received the first part of October will help you during the open enrollment period, which is October 15th through December 7th. And inside the front page is a page that says, what's new in Medicare? Something has changed over the years and over the year. And Kimmy, tell us more about what's new.
Well, you know, I always think this is so exciting because I love to see Medicare going forward and taking proactive steps to make folks' benefits better. So the first thing is, and I think this will be on the list for a long, long time, is just that Medicare.gov, 1-800-Medicare, are great resources for COVID-19 if you want to find something out, if you have a specific question. Maybe you have a question about COVID-19 and Medicare and what testing you can have done or something like that. Certainly those are two great resources, and we want people to, there's no dumb question.
Right.
So reach out and ask the questions, and at any rate, I think that'll stay at the top
Kimmy,
of the list.
that's particularly important because seniors are a high age group for getting COVID. So if we have questions, if you should wear a mask, maybe what the indicators are, and should I talk to the doctor? You can talk to your doctor, or you can give the 800 number.
Absolutely.
On the
and what I always think is that it's nice to have, a few different resources, so that you can kind of pick which ones, are the most comfortable for you and what you have the most faith in. So absolutely. Yeah. I think it's a great idea.
And wait, there's more.
Yes, there is. Well, and this one's pretty big and pretty awesome, and that is that there's a new kind of program for lowering out-of-pocket costs for insulin. And I think that is such good news because I think we all know, we've seen on the news rising, and we've seen at the pharmacy, the rising price of insulin. And this is a way, Medicare for a number of years now has been attempting to make that easier on folks financially, and this is just another step forward for them. And it's called the Part D Senior Savings Model, okay? So, and I don't, nobody really needs to remember that. When you call up the ship counselor and talk about insulin, you just say, I heard there's a new program.
Yeah.
And the ship counselor is going to know.
Right.
They're so well trained, they're going to know what that program is.
Yeah.
So you don't have to remember all that long fancy name. But the good news is that program is being set up to save folks an average of $446 a year. I mean, that's a pretty good savings.
Yes.
Certainly we'd like it, nothing if we could to have to pay, but very good savings.
Yeah.
So look into that. The other thing that we want to mention is that with the Plan Finder, we talked about how when you have an account and you have the Plan Finder already set up with your medications, every year that just rolls forward. You don't have to do anything extra. And so if you put in insulin, it'll flag in the system that you would want to look at one of these plans.
But now the Plan Finder pulls up your medications because Medicare pays for that, so it sets into your Plan Finder, your account, the medications that you're on, so you don't really have to worry about spelling them correctly.
Absolutely
if
not.
You've received them already.
That's right, exactly. I mean, the Plan Finder just keeps getting better and better in my view. Okay, the next we have with the Medicare Advantage plans, a really big one, which is you can now have ESRD, which is end-stage renal disease. If you have it, you are allowed to join a Medicare Advantage plan. Huge change. Didn't used to be that way. Now it is. So if that's something you're interested in, talk to your ship counselor about it. Acupuncture coverage.
Yeah.
Now there's a biggie. Acupuncture coverage for back pain. And it's pretty specific to certain, issues with back pain and such. So if that's something that you think you want to look into, you just talk to your doctor or your acupuncturist. By 2021, they will know.
Yeah.
And then also, and I want to, just quickly talk about this, and we can talk about it in the last segment as well, the telehealth.
Yeah.
Becoming bigger and bigger and more expanded, and so important, most especially for a place like Montana, where you might have to drive miles and miles and miles to see a practitioner.
Yeah.
So Medicare has seen the light. And I think the pandemic brought it to them, where the telehealth model is becoming extremely important, and they're doing a really good job getting it going.
Yeah, I know they've been working on that telehealth model for 20, 30 years because I was involved with promoting it a bit, and it's nice to see it's finally here and it's taking us to get it going.
And I just, my hope is Montana has a big digital divide, and that means we don't have the greatest internet in the world here, and especially if you're low income, it's harder to have internet access. So we all have to work together to make it a good experience, but I'm certainly very glad we have it.
And you mentioned that the telehealth is important for rural Montana, but I've used it right here in Helena with my doctor across town, and that comes in so handy, and you can take pictures, you can ask the questions, and they're available because they mostly have patient portals too, so you can access your doctor right away. Well, now we're quickly drawing to a close on this segment, but we've got a lot more great information. Stay tuned. We'll be right back.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore. In our last segment, we were talking about telemedicine in Montana, how it's available throughout the state, even to a provider that's a couple blocks away or hundreds of miles. But now, Kimmy, when we concluded our conversation in the last segment, we really didn't cover something about providers.
Right.
Tell us more why that's important.
Well, I think all of us are a little confused who of the providers can actually give us a telemedicine or a telehealth appointment, because if you don't pick the right one for certainly under Medicare, then it doesn't get covered.
Yes.
So you want to make sure. And so I made a list of some of the different providers that folks can look to for telehealth who are on Medicare. Okay, so we're talking about doctors, nurse practitioners, physician's assistants or PAs, physical therapists, occupational therapists, speech language pathologists, licensed clinical social workers, and clinical psychologists. So, and there might be more.
Yeah.
Okay. So what the person wants to do, if they want to have telemedicine visit with one of their providers, is they call them up and ask, and they just find out.
I wish dentists were on the list. Then it truly would be painless.
Yes, I know. Isn't that the truth? Yeah. But and I think, as you said last segment, it doesn't have to be that you're in the middle of nowhere. Yeah. We're seeing winter come, so who wants to drive around in the wintertime if you could do it from a home and be safe and warm and and also protect yourself from COVID as well by not going out.
And in the patient portals, usually there's ask a question and a PA or someone. You just have a simple question. You don't want a 10-minute appointment to go into town, and you can get an answer back right away, whether you need an appointment or not. So that's convenient.
Exactly. And, I think it's a really great way to sort of triage as well, because so many of us, I know all the time, I think, I wonder if I should call the doctor about, and you don't really know, and this is a great way to not have to go haul yourself over there and take up a lot of time. So
pay a deductible.
It is, and I do want to say, in terms of COVID specifically, that we want folks to remember that although SHIP counselors are going to be there for them this year, just like they always have been, they may not be physically in their office like you're used to.
Yeah.
So
makes sense.
Yeah, another good reason to call ahead and call early when you're trying to get set up with a SHIP counselor. One, to make sure that you can even get onto their schedule because they're busy, real busy. And two, where they even are set up these days. And again, it isn't that they won't be there to help. They are going to be there just like they have been for many years. And we'll be happy to help. We just may see it in a different format.
They're there to help you.
Exactly.
But now, what's not covered in Medicare and You or in the Plan Finder is the different helping programs that Montana has to help pay some of the premiums if you're eligible. And there's a variety of eligibility issues or requirements. And that's where the SHIP counselor can help you out, right?
Yep, absolutely. And, first of all, let's be real clear. This is a hand up,
Yes.
not a handout.
Yeah.
People have worked and supported their communities and their families for years and years. This is not charity. This is simply a financial hand to get you through. So there's 3 really good programs that I want to make sure our folks know about. One would be Medicare Savings Program, and you know, us acronym stadies, we like to say MSP, or Medicare Savings Program. That helps pay for Part B. And you know, the premiums and deductible, that kind of thing, depending on where your eligibility is. There's something called the LIS, or the Low Income Subsidy. That helps specifically with Part D, so the drug plans. Again, there is eligibility criteria. You talk to the SHIP counselor and they can help you with that. But that helps pay for the drug plan piece of your Medicare. And then we also have Big Sky RX. And Big Sky RX, you know, I think we can be real proud of. It's a homegrown Montana program, and it helps folks pay just that premium, monthly premium for a Part D plan. And what I love about Big Sky RX is it's for folks that you can have a little bit more in terms of income and that sort of thing. They don't look at your assets. You know, they're only looking at how much you make, and it's slightly more generous than other programs. So folks that aren't used to ever being eligible for anything might be.
And you know, you can talk to your SHIP counselor and they will review that eligibility. Instead of you looking at one program saying, I'm not eligible for that, so it could be that you're eligible for a number of them.
Yes, and you know what? At worst, it'll be no, and at best, you'll have had a great conversation with a really nice person in your community.
Exactly. Well, you know, now quickly, we haven't really spoken about Medicare Advantage, but the Plan Finder can help out with that Medicare Part C.
Yes, and this is also the enrollment time for that. So you want to make sure if that's something you're interested in, talk to the SHIP counselor about it. And two, yes, it's a part of the Plan Finder. So you can find all the same information that you need for a MA plan as for a Part D plan.
Part B. And you know, we've quickly drawn to a close on the show. Thank you so much, Kimmy. There's so much information. Again, you know, for our viewers, you know, remember, this time of year, get a flu shot. Our open enrollment is from October 15th through December 7th. That's coming up pretty quick. And that's the time that you evaluate your Medicare plans or your Medicare Advantage. Are they meeting your needs? Are you aware of certain procedures or things that you will have to have done medically next year? Well, by planning now, you can help defray the cost of that by picking an appropriate plan. Of course, our SHIP people are there to help you. They'll help you get the new programs that are available throughout Medicare, and we'll talk to you more soon in about a month. So thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.